Electroconvulsive therapy is the title of this evidence-based presentation. It is being presented by Trillin Victorian, a student at the University of Texas Rio Grande Valley Postmaster Psychiatric Mental Health Nurse Practitioner Program. I decided to discuss electroconvulsive therapy because even though this therapy has been around for years and years, I do believe that it is an underutilized treatment modality in regards to psychiatric mental health disorders. And I hope by presenting this topic, it will help to just provide a little bit more insight on this great treatment option that is beneficial for so many patients. Electroconvulsive therapy involves applying an electrical current to the brain to induce a seizure. Since the 1940s, ECT has been considered the most effective intervention for severe mood disorders. The use of ECT was decreased once antidepressant medications were introduced. By the 1960s, due to the increase in available medications and the media's and film industry's portrayal of ECT as inhumane, the use of ECT declined. Several long-term studies show that patients who receive ECT have reduced mortality compared to non-ECT control patients. ECT in pregnancy. Psychiatric disorders are common in pregnancy, affecting 15 to 29% of pregnant women. During pregnancy, psychiatric disorders can worsen during pregnancy due to hormones and changes to the mother's body. Untreated depression has negative health consequences on the mother and the fetus. The safety of ECT in pregnancy has been documented for the last 50 years. The most common adverse event to the mother were premature contractions, premature labor, and occurred more in the second and third trimesters. Risk of ECT. One of the main risks of ECT therapy include cognitive impairment. The three main categories include acute confusional state, which is no awareness of location and time. These symptoms may last up to 3 hours following an ECT procedure. Anterograde amnesia, which is impaired ability to retain new information, and retrograde amnesia, which is impaired memory for events that occurred 1 to 3 months prior to ECT. All cognitive ability is usually restored within 15 days. Practice change. ECT should not only be recommended as a last resort, but can be recommended in severe cases of major depression. Ketamine is an anesthetic agent resulting in rapid antidepressant effect, with effect noted in 24 hours and lasting up to 7 days. Ketamine might enhance the antidepressant efficacy of ECT in non-pregnant patients. ECT may be an effective option for pregnant patients due to certain pharmacotherapy risk to the mother and fetus due to side effects. Implications for practice. ECT is an effective and safe treatment for treating pregnant and non-pregnant patients with severe mental health disorders. Recent studies also show that for short-term treatment of major depression, the combination of ECT and pharmacotherapy achieves greater results as opposed to either intervention alone. Maintenance ECT means these are treatments that occur beyond 6 months. Presentation of evidence. Relapse following acute ECT range from 40 to 60% at 1 year, 63.6% and 29%, 42.7% and 51.6% at 6, 12, and 24-month periods, respectively, with median relapse-free survival of 21.5 months. These relapse rates are comparable to 1-year relapse rates after discontinuation of maintenance ECT, which varied between 57 to 62.5%. Therefore, maintenance ECT could be a powerful adjunctive tool to antipsychotic continuation for relapse prevention. Relapse after discontinuation of ECT in patients with schizophrenia is significant. These listed are research studies. The first one involves electroconvulsive therapy during pregnancy. It's a systemic review of case studies. that shows ECT in pregnancy. The second study is titled Acute and Longer Term Outcomes in Depressed Outpatients Requiring One or Several Treatment Steps. And so this discusses treatment resistant depression and how certain patients who are resistant to treatments, they are trying different antidepressant medications and they're not working. Therefore, ECT would be a better option for them instead. The third study is titled Patients with Schizophrenia or Schizoaffective Disorder Who Receive Multiple Electroconvulsive Therapy Sessions, Characteristics, Indications, and Results. And this discusses side effects of ECT that seldom led to discontinuation. Recommendations by researchers. Treatment modifications have been consolidated into a protocol that can assist clinicians in improving access and safety of ECT in pregnant patients. It's also important that a gynecologist is involved with these patients throughout their pregnancy, of course, and throughout their ECT treatment as well. The most important considerations are the stigma associated with receiving the treatment on the part of patients and in recommending or administering the treatment on the part of professionals. In the 1960s, when ECT therapy started to decline, one of the reasons was because of the stigma of ECT. I think that this could be alleviated by providing education in regards to ECT treatment, the benefits, the risk associated with the treatment, the fact that a lot of the side effects are usually resolved within 15 days can help with some of the stigma that's still associated with it. The third bullet, maintenance ECT, could provide a modality for relapse prevention in conjunction with continued antipsychotic treatment. And this slide includes the references. And thank you for watching my presentation.